I'm Michelle Sanderbeck, and I am a naturopath and a Loomis Digestive Health Specialist, and a bunch of other initials at the end of my card. I like to consider myself a wellness coach. My job is to help you get well. So the question I have for you today to start out with is, if you've gone to 4, 5, 10 different doctors and they haven't been able to determine what's going on, why is it that you still have the symptoms or you're still ill? What is it that causes the challenges that make it that you cannot identify what your health problems are? My job as a wellness coach is to help identify what's going on in your body, looking at your body as a whole unit. Not just my esophagus has trouble, my stomach has trouble, I've got colon issues, or I have heart issues or lungs. The whole body is connected. It's kind of like that old song, I'm sure you remember. Hip bone connected to the thigh bone. We're all connected. So my job is to help identify what's going on in your body and help you figure out why we have it and then figure out a plan. I work with people all over Waynesville, Silva, Haywood County. I have people that come to me as far as California and Kentucky and Maryland, all over the place. And the reason they do is I have a unique approach to health. And this unique approach that I have gets results. So I'm not certain what brought you here today. I know that we had in the paper information regarding digestive and bowel disorders. And so maybe you have some digestive issues. Maybe you have acid reflux or heartburn, or maybe you have colitis or Crohn's or celiacs. Maybe you have something that is similar that would be affected by your digestive tract, like not being able to digest sugars and fats properly, so type A diabetes or blood sugar issues, or cholesterol or triglycerides. Maybe you have other issues that, or maybe someone you know has issues with headaches or different types of issues that would in fact maybe actually start in the digestive tract. Sometimes it's just a matter of you came here because you're healthy and you want to stay healthy. And I want to commend you for that. And so I'm very excited for you to come and hear some information about how we can work with health concerns today. And I'll probably talk about some things that you've probably never, not heard of before when you go to your traditional doctors. So before we actually start, let's talk about diseases, human diseases. And there's two types. One is infectious. We know what infectious is, right? Pneumonia, or a cold, or flu, maybe STDs. These types of communicable infectious diseases you get when you are in contact with someone. So when we were talking earlier about Crohn's disease, I am not going to get Crohn's disease by hugging on this lady, or get the acid reflux because I am kissing on my sweetheart. That is a different kind of disorder. Infectious diseases, I don't do. I can't help you with infectious diseases. But I can help you with the other kind, which is called functional disorders. And functional disorders are called that because there's a breakdown in how your body is functioning. It should be doing something and it's not doing it properly. That's my specialty. That's what I do. I work on trying to figure out what we need to do in allowing your body to function properly. So I work on restoring normal body function. Today we're going to talk about digestive and bowel disorders. And so if I can get this going, let's see. All right, so talking points. We're going to talk about the most prevalent digestive and bowel conditions, what causes these conditions, discover why digestion should be your #1 first priority, and then identify the missing link to natural healing. So, most prevalent bowel disorders or digestive disorders according to the NIH: GERD, Gallstones, Crohn's, ulcerative colitis, irritable bowel syndrome, and chronic constipation. So let's just jump right in. GERD. GERD happens when a muscle at the end of your esophagus doesn't close properly. This allows stomach contents to leak back in or reflux into the esophagus, and it's going to irritate it. Stomach acids are really acidic. The rest of our body can't deal with that type of acidity. You may feel burning in the chest or throat called heartburn. Sometimes you taste stomach fluid in the back of the mouth. This is acid indigestion. GERD, in my professional opinion, happens in some of the cases, but it happens in a minority of the cases. I have a different theory on that. So let's talk about the gastrointestinal tract for a second. It's just a big old hollow tube. Got a muscle on the outside, got a muscle on the inside, and then you have the mucus lining. And the mucus lining serves two purposes. First, it's going to lubricate your food, or lubricate the gastrointestinal tract while the food is going down, so it goes down relatively easily. Second is to protect the body from the stomach acids. They're pretty acidic. They burn. So what happens is if the integrity of your mucosal lining is compromised, and it can be compromised for a variety of reasons, but when it's compromised to these certain factors, you're going to experience heartburn and reflux. We've got a compromised mucosal lining. What should we do? Maybe we should help support that mucosal lining and happen to build it back up. Next one, gallstones. Your gallbladder is most likely to give you trouble if something blocks the flow of the bile through the bile ducts. That's what is usually called a gallstone. Gallstones form when substances in the bile harden. Gallstone attacks usually happen after you eat. Signs of a gallstone attack may include nausea, vomiting, pain, abdomen in the abdomen, back, or just under the right arm. So what they're saying is some kind of substance forms or hardens, and that's what causes gallstones. Well, what are these substances? Why are they in my bile? And where did they come from? And why all of a sudden do they spontaneously harden? What happens is this: the viscosity of the bile is in the liver, and the gallbladder is in direct proportion to how well you can concentrate hydrochloric acid in your stomach. They are directly linked to each other. So if you have a problem concentrating hydrochloric acid in your stomach, then what happens is your body has to compensate. And it's going to take the minerals from the liver, the bile in the liver and the gallbladder, minerals and your sodium, and wherever minerals go, water follows. So when I'm taking minerals and water out of the bile, that means the bile is going to thicken, and then it's going to form gallstones. So what do they do with gallstones? What happens? Your doctor says you have gallstones. What do they do? They take the gallbladder out. Well, that's great, but it never addressed the underlying digestive issue of the hydrochloric acid production. So without addressing that, we still have a situation where we're going to have thick bile. Crohn's. Crohn's disease causes inflammation in the digestive system. This disease can affect any area from the mouth to the anus. It also affects the lower part of the small intestine called the ileum. Common symptoms are pain in the abdomen, diarrhea. Other symptoms may include bleeding from the rectum, weight loss, joint pain, skin problems, and fever may also occur. Ulcerative colitis is a disease that causes ulcers in the lining of the rectum and the colon. Ulcers form where inflammation has killed the cells that usually line the colon. The most common symptoms are pain in the abdomen, diarrhea, bloody diarrhea. Also could have anemia, severe tiredness, weight loss, loss of appetite, bleeding from the rectum, sores of the skin, and joint pain. And then lastly, IBS is a problem that affects the large intestine. It can cause abdominal cramping, bloating in the bowel, and change in bowel habits. Some people have constipation. Some people have diarrhea. Some people do the dance and flip-flop back and forth between constipation and diarrhea. Now, what happens is all three of these are very similar, and they're actually diagnosed in a very similar way. One you use an endoscopy, the other you use a colonoscopy. Basically, what they're looking for is damage to the intestinal tract. So, depending on where they find the damage is what you get. So, if you have damage in the large intestines, it's called colitis. If you have damage in the small intestines, it's called Crohn's. And if they can't find damage in anywhere, you're called irritable bowel syndrome. Right? Mechanism's exactly the same. We've got inflammation going on. It's just where is that happening? Then we have constipation. Constipation, according to NIH, constipation means that a person has 3 or fewer bowel movements in a week. The stool can be hard and dry and sometimes painful to pass. So let's talk about this for a minute. How many times a week do you think you should have a bowel movement?
Every day.
Every day. Once a day, twice a day, 3 or 4 times a day.
Depends on what you eat.
Depends on what you eat. Normal bowel movements, the norm is 2 to 4 bowel movements a day. And they should be 30 to 60 minutes after you eat. You should have your bowel movement. And if that's happening, you know you're running a really tight ship. Technically though, if we go by that 2 to 4 a day, if you're only having 1 bowel movement a day, that's considered constipated. Now, 3 or fewer a week? Could you imagine? I mean, think of all the things that could be going on and crazy in that colon and bowel area, in the intestines. It amazes me. Okay, so let's talk about the statistics on these top 6 conditions. GERD, gallstones, Crohn's, ulcerative colitis, IBS, and constipation. Boy, those are big words. First of all, 159.2 million people are affected by these conditions, of which 31.2 million actually go to the emergency room for treatment. Hospitalization is 4.8 million, and prescription medication is 81.1 million. That's only the people that go to the doctors. What about the folks that have the symptoms, but they're not quite so bad that they feel the need to go to the doctor or the hospital? What are they going to do? Typically, they go over to the pharmacy and they're going to self-medicate. So what do you think the top 4 over-the-counter medications are that were sold in 2011?
Magnesium.
Well, you've got, first one is for cough and cold symptoms. The second is your anti-inflammatories. Third is your heartburn or antacids, which would be your milk of magnesia, which could go in there or actually go into the 4th section, which is laxatives. And you know, it is the funniest thing. That says when I made this program 1, 2, 3, 4, and we've got 1, 3, 5, 7. I don't know why that did that, but I'm going to. So, over-the-counter medications, we've got a total of 8.67 billion medications. That's a lot of over-the-counter medications where we're self-medicating. So if we take a look at these, the first two, 1 and 3, for cough and colds and anti-inflammatories, what system do you think is being affected that they would need to pick up this type of medication? Immune system, exactly. And how about the second two, 5 and 7, heartburn and laxatives? What system do you think that is? It's your digestive system or your gastrointestinal area. So if we look at this, the top selling medications that were sold in 2011 were because we had immune system challenges or we have digestive challenges. Remember that. We're going to come back to that in a little bit. So Dr. Loomis, this is the man that I study with. He's an amazing man. He's created the Institute for Enzyme Nutrition, and that's where I've trained, and I work directly with this man. He's been doing this for 40-some years. He's an amazing, amazing fellow. And his work with nutrition, he says that normal body functions cannot be restored and health cannot be maintained by using drugs because they all have side effects. Drugs are made to interfere with the human enzyme system. So let's explore this a little bit farther. If there was one cause, just one, of all of these conditions that we just talked about, those top 6, what do you think that might be? I thought I heard it.
I think you said stress.
Stress. That is absolutely correct. It's right there on the top of that little survey we took. So let's take a look at the survey. On the top section here in number 1, just by a raise of hands, how many of you have one or more of these symptoms on a daily or several times a week situation? Okay. And then with a show of hands, number 2, 3, and 4, how many do you have the symptoms actually control or interfere with your daily activity and have one or more of these items in this section here checked? Same hands. So, here's the question. Do you think that we were put on this earth to experience the symptoms or experience symptoms that would cause the pain or have these symptoms create a point where we could actually interfere with, where they actually interfere with our daily life? Do you think we were designed to have symptoms to interfere with our daily activity? No. So if the answer is no, why does the body give us symptoms? Why do we get symptoms? What are they all about?
Don't eat right.
Okay, we don't eat right.
Not drinking enough water.
Not drinking enough water. The symptoms are telling us that something is wrong. It's kind of like the check engine light. You know, you get the check engine light that goes on in your car. Do you drive around? Are you the kind of person that drives around and as soon as that light comes on, you beeline it straight to the mechanic? Or do you wait a week or a month and then go have it checked out? Same thing with our body. The only way our body has to communicate with us is if something is not properly when something is not properly functioning, is through the use of symptoms. So whether you have the symptoms and take care of them, or you do nothing about the symptoms, if they keep coming back, it's an indicator that the root source cause or the underlying cause has not been identified yet. That's what symptoms are all about. So Poncellier, anyone heard Poncellier? He's the guru, he's the father of stress, he's known as the father of stress. He came from a family of physicians, earned 3 degrees, an MD, a PhD, and a Doctor of Science, which is like the top of the top of the top. He's like a brainiac kind of guy. He wrote over 1,700 scholarly papers, 13 books on stress. And what he says is this: stress is found, Dr. Sayed found that stress has a specific cascade of psychological events when a continual demand is made on the body to adapt. And if not recognized, stress will progress from an alarm reaction to what is called exhaustion. Your body gets exhausted. That's where you start having the appearance of symptoms. And if it continues on, disease will start to be created, degeneration will happen, and then the bottom